I'm Harlan Krumholz, editor of JACC. I'm here with Kushal Kadakia, the deputy associate editor at JACC. We're here at ACC.25 in Chicago, day 3. There continues to be great stuff coming out. What excited you today?
Some of the last and some of the best. We have the new secondary analysis from the Summit trial. This is a trial that came out last fall looking at tirzepatide, which is a dual GLP-1 GIP receptor agonist therapy for obesity, now being shown to have effect in heart failure with preserved ejection fraction. This morning, Harlan, we saw how actually when we look at patients that also have chronic kidney disease, we see benefits and improvement in renal function. But I think it also informed how we should think differently about measuring renal function.
Yeah, it was a great study because it was comparing different ways of measuring renal function, creatinine, cystatin C. You know, in these patients who have obesity are being treated this way, there's concerns about sarcopenia. Does creatinine really represent renal function? Could it represent the sarcopenia manifesting itself? Cystatin C seems better. It was a great study for also telling us and directing us about what the best ways to measure renal function are. But there's more, right? There's more.
I mean, there's a ton of translational science at this meeting too. I think that one of the great things about scientific sessions is we see both the outcomes trials that'll change practice, as well as giving you a sign of what's coming down the pipeline. So some of the things I was most excited about was new data on lipid-lowering therapies, both addressing some of the residual risk from triglycerides. We have a great study from our friends at JACC Asia that have led, looking at new monoclonal antibodies for ANGPTL3, and then also seeing new oral options for PCSK9.
So this is just what's coming down the pike. You'll see it in JACC. We are investing in publishing early phase studies. Of course, as outcomes researcher, I want to see, bottom line, is this actually going to save lives, improve outcomes? That'll be the next step. But these are exciting studies sort of showing you what's coming next.
So it's been a great weekend here in Chicago. We've been really excited to engage with clinicians and researchers, and hope you'll check out the latest studies now online at JACC.org and coming to you in print just in the next few months.
Yeah, it's been a pleasure talking with you.